Hello, welcome to the Hawaii Health Data Warehouse Coffee Break Monthly Webinar Series. I'm Tanya Lowry St. John with the Hawaii Health Data Warehouse at the Office of Public Health Studies at the University of Hawaii at Manoa. We're going to use the next 30 minutes to introduce you to the 2022 Behavioral Risk Factor Surveillance System data, also called the BRFSS or BRFSS data in the HHDW.org and HawaiiHealthMatters.org websites. The presentation and demo should take about 20 minutes, and then we'll have a few minutes left for questions and a hands-on activity so that we finish up in half an hour. So let's get started. The Behavioral Risk Factor Surveillance System, or BRFSS, is an annual telephone survey that uses cell phones and landlines to collect data using a complex sample design. The responses are weighted to represent the adult population using the same ranking methodology employed by the U.S. Census. About 7,700 adults are surveyed in Hawaii each year. In Hawaii, the survey is managed by the Surveillance, Evaluation, and Epidemiology Office of the Chronic Disease Prevention and Health Promotion Division in the Hawaii Department of Health, in collaboration with the Centers for Disease Control and Prevention in Atlanta. Archana Pant, the state BRFSS coordinator, and her team do a fabulous job, and we are very grateful for their work in coordinating the survey, overseeing data collection, and making the data available to us all. The HHDW warehouse has BRFSS data from 2000 to 2022, and the HHDW website has BRFS data from 2011 to 2022 due to a change in survey methodology. There are over 300 BRFSS indicators on hhdw.org and over 140 different indicators on HawaiiHealthMatters.org or HHM. The BRFSS covers a wide variety of topics, which you can see here, and not every topic is covered each year. For example, nutrition and physical activity questions are asked on alternatingly on odd years, and oral health questions are asked on even years. You should know that we can and do customize the survey for Hawaii using the state added questions and optional modules, which change from year to year. Let's talk a little bit about building custom BRFSS reports in hhdw.org. When you click on this Build a Custom Report button on the website, will bring you to that health indicator selection page. This functionality allows you to build and run custom SAS queries on a live data within the system. In the BRFSS module, for each indicator, you can select the response, so yes or no or categorical, the year, either single or multiple, the geographies, these are the geographies that we have available, age, and sex for the respondents. Data quality is assured because cells with denominators of less than 50 or standard relative errors of 0.3 or greater are suppressed in accordance with BRFSS reporting standards. When this happens, we suggest try adding more years to your query or reducing the number of filters. Data can be filtered or displayed by a variety of demographic characteristics that are shown here. So it's a whole bunch of different options that you can do to customize your query. And they can also be displayed by these selected health behaviors or conditions, including diabetes, obesity, ever being diagnosed with cancer, currently smoking cigarettes, and meeting physical activity guidelines. Most of the indicators can be viewed by crude and age-adjusted rates, and all yes and no indicators can be viewed by 2 dimensions. Here you can see this display by and group by drop-down menus that will be available in the system. So all the data can be viewed by all of these dimensions, and we'll come back to these in a minute. The BRFSS data indicator are organized into categories and subcategories on the website. So here you can see how the data is organized within hhdw.org. And you can see, so we have access to healthcare, chronic conditions, demographics, general health status, and so forth. And you can see that we try to keep it alphabetical. Once a survey question has been asked the same way for at least 2 years, then we create a health indicator for analysis. And this year we've added 19 new indicators, which you can see here. So this will include 2 new indicators for health insurance and healthcare access. These are based on new survey questions, and we'll get to that in a second. And then we have new indicator for heart disease and cancer, as well as an expanded household income indicator. There are 4 new indicators for spinal cord and traumatic brain injury, 2 new yes-no indicators for physical activity in neighborhoods, There's some expanded indicators for sunburn, which we're also going to talk a little bit about today, and then also immunizations for HPV and tetanus. And there will be coming, we have one colorectal cancer, but there'll be a bigger section of colorectal cancer screening indicators that are coming soon. There were some issues with how the logic was going for those, and we didn't want to hold up the full release for those, but they'll be coming out shortly. And you can check our website for information. Lastly, we've updated the data source page for the BRFSS to make it easier to access that survey documentation, including things like annual sample size, the survey instruments. And you can scroll down on this page to be able to come to report request and also our record level data request. So let's go ahead and get started. The easiest place to start is from our homepage, hhdw.org. And from here, you can go directly to Hawaii Health Matters and view the BRFSS data there. And I'm going to put a link in the chat, and it will also be in the notes for all of the BRFSS indicators that we have updated in Hawaii Health Matters. And then you can also go ahead and, if you want to go directly to building your own report, you can go here and then click on the BRFSS data. So that's one way to get to the data to do your analysis. Another way is to come up here to data sources and come to BRFSS data. The BRFSS data source page provides you with general information on the survey itself, so learning more about that, as well as links to the Hawaii questionnaires, because one of the questions I get most is, how was that asked? You can actually see the logic right in there, the annual data release notes, and then the extensive documentation provided by the CDC. So here you can see that in 2022, there were 7,747 adults who were surveyed. Here you can go to the actual questionnaire, and then you can click here on the data release notes to see all of the new indicators that we created this year. And as we add new things, they'll be updated there. Scrolling down on this page, you can find our links to our report request. So this is where you come when you've been working with the data and you still can't find what you're looking for. So you can send us a report request. Or if you want record level data to do your own more in-depth analysis, you can click on the record level data request, and that will take you through the step-by-step process of doing that for BRFSS. So we're going to click on this little icon here to come back up to the top throughout the system, and we're going to go to build a custom report. And that is going to bring you to our indicator selection page. So this is our BRFSS Health Indicator Selection page. And here you're going to see, again, the link to those data release notes and also the link to the latest video. As we showed previously, the data is grouped into categories. And then by clicking on one of these triangles, you can expand those categories to see the different information underneath. So let's go ahead and take a look at that question of having a personal doctor. In the system, when you see this sort of overall overview of this is healthcare access, have a personal doctor, what does that mean, HCP, healthcare provider? You can come over here to this question mark, and that will say, do you have one person or a group of doctors that you think of as your personal healthcare provider? And you'll see that this one says it's 2021 plus. So this is a new indicator that we've created. And there used to be a question, have a personal doctor, that was worded a little bit differently. And it is, do you have one or more persons that you think of as your personal doctor or healthcare provider? And while those sound pretty similar, they're not exactly similar. And we looked at and we saw quite a bit of difference in the response. So we created a new indicator with this new question. So there, always you can look at the question marks here, can be helpful. Clicking on this down arrow, I can see this is one of those indicators that we have crude rate and age-adjusted rate. I'm not quite sure. I want a refresher on what that means. Again, we'll provide that information to you here. So let's go ahead and do the crude rate and get our standard report. And here you can see that this is going to be our standard report, which is normally 3 years, but this is a new one. We only have 2 years of data, and it's for the state, and it's adults who have a person or group of doctors that they think of as their personal healthcare provider. And scrolling down, you'll see there's a chart. You can hover over the chart to get the information, and you can also come down to the data table, which can be exported to Excel if you want to do something else with that. So you can see here that for all of our data, we'll give you the percentage, the upper and lower confidence interval, and then the count, and then we'll let you know how stable that data is. So in 2022, 88.4% of adults had a doctor or group of doctors they considered their personal health care provider. We know that that's an estimate because we just called people up, but we think that estimate is really somewhere between 87.4 and 89.4. And we want to know how many people that is. That's over 1 million people. So it's 1,600,000 and 900 roughly people, adults in Hawaii, say that they have a healthcare provider. Scrolling down here, if you're in all reports, if you want to go to a different data set, you can click here. If you want to go and explore a different health topic, you can click here, and there's a couple of videos there to help you with that functionality. Then you'll have our data notes, and this is where you will get that question wording. So again, people always want to know, how did they ask that question? Here is the exact wording. If you want to know where it fit in the survey and the skip patterns, you'd go back to look at the survey instrument for that year. We have a little bit more information about weighted data, and if you're using this data in a presentation or report and you want to cite it, here is our suggested citation. Scrolling down, then we have a little bit more information about how we determine statistical stability, how the sample is drawn, where we get that annual population estimate, and what our confidence intervals look like. And then finally, you'll have the information of when you did the data query and when that data was last updated, which you're going to need as you're filling out your citation. Again, I'm going to click on my up arrow to go to the top, and I'm saying this is an okay query, but I want to get this to be more custom. I want to customize it. So I'm going to modify this query. And here I can come to my query builder. The first steps in the query builder in all of our data sources is how you filter that. So then I'm going to make it funnel. I'm going to make it smaller of what I'm looking at. And then that last step is how I'm going to display. In this case, maybe I want to know people who don't have a healthcare provider. So I could click on no and then run the query that way. But for now, I'm going to stay with do. And maybe I'm really interested in this case of, what about by school complex? Are there differences around the state in terms of whether or not people say they have a healthcare provider? And I can go in here and just so that you know, I can do some changes here in charts and I can change and do some mapping, but I want to show you this because I want you to see a map. I'm going to hit submit. And these are going to be, again, that same question. And I'm going to get my chart here. And when you see a big chart like this, it can be a little hard to read. So one of the tricks is whenever you see this ellipse in the system, that means that you can do some work here. So in this case, I'm going to go ahead and sort it ascending. And that way it'll make it a little bit easier for me to see the least and the greatest. So by playing with your data table, you can affect the chart. So that can be a helpful tip. And then also I'll see here that I have for this area, this data has been suppressed. So either we had less than 50 respondents or the relative standard error is so large that we're thinking that it's not going to be reportable. So I might need to wait for an extra year to get enough data for there. But I can scroll down here and then I also have the map within the system. So then I can see the area by the state as a whole to be able to visually inspect who have access or do not have access. And then I can always hold over to get that underlying data. So just wanted you to see the map function. Again, with the query, I can go ahead and make a more complex query. So let's say in this case, I'm interested to know, is having a personal healthcare provider, does it differ by age and sex? So I can come here and do it by age group, and I can do it by sex. And I can hit submit. And now I'm going to see that data and I can see that females are more likely to say that they have a personal health care provider than males. And I can see looking at my confidence intervals pretty much until about age 55, maybe 64, but then it sort of evens out in terms of, and if I want to see that underlying data again with the actual confidence intervals, I can scroll down here on the chart. We'll scroll back up. And now let's take a look at one of those categorical indicators. To get to a categorical indicator, I can go back, or another indicator, I can go to measure selection or select a new indicator. So I'm going to come here and that brings me back to this page. And we mentioned the issue of sunburn. So under screening and preventive services, cancer screening general, I'll see that we have 4 indicators now on sunburn. And with the 2022 data load, we realized that actually they've been asking slightly different questions over the years that have a different response rate. One question is, during the past 12 months, how many times have you had a sunburn? And the other question was, how many times during the past 12 months have you had a red or painful sunburn that lasted a day or more? So if you're interested in skin cancer prevention, this is for you, right? So this is a great place to look. But let's take a look at one of these categorical variables. I'm going to click here. And I'm going to see that for categorical, only crude rates are available. I'll see that for this, we've had this question that's been asked at least 3 years. They're not consecutive. And then I get my categorical response of those that answered none, 1 time, 2 times, or 3 or more times. And here's a little another trick in the system. Let's say I'm really just interested in the people who answered 3 or more times. I can actually click here and sort of visualize then more clearly what that population is. So that can be a fun thing that can be helpful as you're trying to sort of dig into your data here. And also, again, then we have that data available in the table below. Now let's say I want to modify this query, and what if I'm interested in sunburns by race ethnicity? So what I can do here is you'll notice that I can't sort of combine both. So if I'm interested in the most recent data, I would maybe come back here and just select these last 2 years of data. So I can do this, and you'll see here, so I'm just holding down my shift key. So you'll see that it's just these last 2 years of data. And maybe I want to look at it by race ethnicity here. And then I'll get my chart underneath that I can see this way for the table, and then also for the chart, and then this way for the data table. And then I can see in terms of those 3 or more, it's going to be highest among people who were white, American Indian or Alaska Native, or Native Hawaiian. And if I wanted to query this even further, let's say now I'm really just interested in this in Hawaii County. So in this case, I'm going to say fewer people. So I'm going to add more. And I'm going to come here to my geographic area, and I'm just going to say I just want to look at Hawaii County and still by race ethnicity, and hit submit. And then now I can see what it looks like by race ethnicity. I can see here, so I'm looking at 4 years of data for Hawaii County by race ethnicity. And I can go and take a closer look at what my data looks like for Hawaii County. And I can see that it's Native Hawaiian and white, and then about tied for American Indian, Alaska Native, and other Pacific Islander. So those are ways to filter in the query. Okay, so now I want to give you guys a chance to play with and explore the system. So I have some questions for you. So I want you to go ahead and open up and take a look and see what percent and number of Hawaii adults have had coronary heart disease or heart attack in 2022. And then you can modify that query and say, has that changed over time? I would use a line graph for that. And which community has the highest prevalence? You can take a quick look at that on your map. And then go explore the area of traumatic brain injury. What percentage of adults have ever had a traumatic brain injury? How do we define that? And then maybe examine those by age and sex and DOH race ethnicity. And then an extra question on that of what percentage of adults have had traumatic brain injury that resulted in a chronic disability, and see if you can see if there's differences by county. Okay, let's get into those answers. The first question is, what percent and number of adults have coronary heart disease or have had a heart attack in 2022? So I'm going to come back to that measure selection page. And this is going to be under chronic diseases and conditions, heart disease. And this is a new indicator where we combined either coronary heart disease prevalence or heart attack prevalence. And again, you can see that in terms of the questions here. And we're going to take a quick look here and run the standard report. And so adults who have ever been told by a doctor, nurse, or other health professional that they had coronary heart disease or heart attack in 2022, it was 5.4%. And the number of adults would be 61,800. So this line here, right, there's our answer for that one. And the next question is, has this changed over time? So I'm going to click on this thing to come back to the top. And I'm going to see how many years of data we have for this. So I'm going to go ahead and hold down my shift key and select all years. So from 2015 all the way to 2022. And then scrolling down here, I'm going to ask it to do a line bar for that with errors. And I'm going to hit submit. And I can see here, both in the graph and then also in the data table, that it's been somewhere between 4.5% and about 5.4%. So about 4.9 is our average over the years. So it really hasn't changed that much. All of these confidence intervals sort of overlap, but it's somewhere around 5%, right? And then the next thing is to examine this. There's a number that have had this. So which community has the highest prevalence? So I'm going to come back up here, and I'm going to come back now to the most recent data. And if I go ahead and then I run that data by community, you can see it here, which is in the line graph, which isn't pretty, but if you scroll it down here, you'll be able to see it here in the map graph, which is nicer. But you'll see there's a lot of missing data here because it's just 1 year and it's relatively low frequency. So this is one of those great times where you can say, but this is a question that we ask every year. Let me go ahead. We know there's about the same. I'll combine all 3 years of data I'm also going to get rid of that ugly line graph and change it back to, let's go with the horizontal bar this time and hit submit. And then you can see it this way. And again, you'll see that you have a lot more filling there. But you can see in terms of which community is going to have the highest, it's going to be the Nanakuli Waianae community here. Okay. And the next question has to do with traumatic brain injury. So we're coming back up here to measure selection. We're going to go use it this way. And this we have under a health behavior for under injury. And we'll see we have those spinal cord injuries and traumatic brain injury. And so this one is ever had. And so we're going to click here and we're going to go for the crude rate. And so the percent of adults who have ever had traumatic brain injury, and I'm asking to look at the 2 years because it's a low frequency, it'd be 5.1%. And then how is that defined? We asked the folks a question, have you ever had traumatic brain injury that resulted in a chronic disability? And this is one of those that you have the question that they have more than one answer. And so the second part of this is going to be the categorical version. But if we want to know more about who's had a TBI, it's easy to go back now and explore and look at, okay, well, what does that look like by age? And let's go ahead and do it by age and sex and see if we've got enough in there to try that. And so we can quickly see then that overall it seems to be more prevalent among males than females. And then you can also look at the differences by age, and you can look at those separately as you desire. And then the lastly, you can go ahead and take a look. We wanted to see what does it look like by race ethnicity is the question. So also you can see if you want to look at them separately by age group and by sex, that's also available to you. So you can see that's more prevalent, 6.9% from the 18 to 24 down to 3.8% and 75 plus. And you can also look at it by race ethnicity here. So very quickly, you can see you're doing a lot of analysis in SAS, doing multiple years and so forth without having to know how to program. So that can be super helpful. So you can see here, both in the table and also in the chart, and this case might be one of those that I want to go ahead and sort, and you can see that it's highest among American Indian Alaska Natives, but you'll see here that the confidence interval is quite broad because it's a small population, and then you can look at it among other ethnic groups as well. Okay, and then the last question is what percentage of adults have had a TBI that resulted in a chronic disability? So this is going to come back to that measure selection, and then here back for the health injuries, and asking that question. And you can see that the answers here are yes with a disability, without a disability, and no. So in 2022, you can see that it was 1.5% said that they had a traumatic brain injury that resulted in a chronic disability. And again, if you want to then look at adding these two together, you would come back here and modify your query, and you would want to look at it by the state as a whole, because that would add both of those 2 years together, Hawaii overall, to get you that overall estimate of 1.4%, or about 13,700 people, adults living in Hawaii, have had a traumatic brain injury that has resulted in a disability. Okay, so again, thank you very much for your time. I will hang out if people have more questions. We look forward to seeing you in April, where Julia will be showing you the Socio Needs Index Suite in Hawaii Health Matters, which has separate indices for health equity, food insecurity, and mental health. And in May, we're going to cover topic centers in Hawaii Health Matters. And then I will also go ahead and put up the answers here for folks if you want to get a screenshot of that, but it will also be on the video. Thank you. Have a great day.